Welcome to the Awe and Wonder podcast. We're talking about vision and AAC in this series. We're so excited for our guest today. I'm Sarah Kinsella.
And I'm Brenda Del Monte.
And today we're joined by Tanna Neufleld, who is a speech and language pathologist and an AAC enthusiast. Tanna's clinical interests include working with complex students with vision, movement, sensory, and social emotional differences. And in addition to clinical work, Tanna teaches graduate coursework in AAC as an adjunct professor at the University of Washington. And Tanna, that's where I met you while I was doing a guest presentation there. So, and also you have a nonprofit organization supporting the AAC community, and we'd love to hear a little bit about that, and then tell us a little bit more about yourself, Tanna. Thanks for joining today.
Yeah, thanks both of you for having me. As Sarah said, I am an SLP and an AAC enthusiast. I don't like to call myself an expert because we're always learning, especially when it comes to supporting kids and young adults with vision needs. In addition to the work that Sarah described, I also do a lot of school-based work right now. So my primary role is actually as a school-based virtual therapist, working exclusively with AAC communicators who have a range of different challenges and strengths. So I'll be excited to talk a little bit about that today as it's relevant. And I also do some early intervention work. So I'm an AT consultant or assistive technology consultant for the Early Intervention Colorado program. And that is where I get to use a lot of my assessment skills and my coaching skills to help other professionals who are working with really young children who have complex communication needs and also complex access needs. So hopefully we'll get to talk a little bit about that as well. Let's see what else. I bring a bit of a personal passion to the field of low vision and blindness. Says myself, I am a person with low vision. I have something called Stargardt's macular dystrophy, which has created a loss of my central vision. And so I am considered legally blind, which is a term you might see come up in some of the paperwork for clients and students that you serve. And so that basically means that I don't see perhaps nearly as well as most people that are fully sighted, and that would make me someone with low vision. And so we're going to talk a little bit about that, I imagine, today as well. But that's my personal side. And then, of course, my professional connection to vision kind of stems from the fact that I've been interested in AAC throughout my entire career, even as a graduate student. And as you all have probably realized, many of our AAC communicators bring with them different needs that are not related directly to their communication. And so I was finding as I would encounter these very complex students that they almost always had some sort of vision need. And so that really got me excited and enthusiastic to keep building my skills and my knowledge in this area.
Have you done any data? Like, do you know the percentage of kids that you work with complex needs that have some sort of vision? I did do some data on mine, and I think it was like 60%. Is that higher or lower than what you observed?
So my personal caseload is 99.99999%.
Sure.
But actually, I've done a few presentations on vision and AAC considerations, and the range is pretty striking. Actually, it's between like 45 and 78% of children and young adults with developmental disabilities have some sort of vision involvement. And then, of course, when we get into our kids with significant physical challenges, like our children with cerebral palsy, and we think about cortical vision impairment, 60% or greater, as high as 78% I've read, right, have this involvement. And we know that's because brain involvement creates vision involvement for most of our students and clients.
Right.
I just want to jump right in and say, you touched on something about for yourself being legally blind. And I feel like that we have talked about this with a previous guest as well, but it's like we almost want a different word for that, because I feel like the lay person thinks of legally blind as you can't see anything. So what is the definition of legally blind?
Yeah, I'm really glad you asked that, because I also I'm not personally offended by the word necessarily, but I find that it's like weird to say. It doesn't really roll off the tongue, right? And so legally blind basically means that on paper, or for legal reasons, meaning for the case of getting benefits or insurance coverage or special programs affiliation, that you fulfill the criteria of blindness. There's a number that most institutions or organizations have for that, right? So I don't know what the number is now, but I think when I was diagnosed, it was like you needed to have like 2200 or lower visual acuity in at least one eye, I think. The criteria varies, but in essence, just know it's like a legal diagnostic criteria that really is there for eligibility reasons. But under that umbrella of legally blind, right, myself, I have 2300 in one eye and 2200 in the other, which if anybody's taken an eye exam, you know, that chart they make you read, that's got the E at the top of it, right? So that's a chart used to develop your acuity. The doctor does that, and I can see the E. That's on that chart. And then someone who is higher in that number, so lower in their visual acuity, like 2500, for example, or 2700, they may not even be able to see the E. And so they would still be considered legally blind, even though their functional use of vision would be far less than mine. They may actually need to do a finger count, right, at an eye exam in order to be able to show what they could see.
Yeah, thanks for clarifying that, because I think that's really important for parents and for us as therapists to consider all the different variations, like you said, that are under that umbrella of legally blind. For you, Tanna, you mentioned that your central vision is impacted. Is that right? And so you mentioned earlier, you know, in our just side conversation, that you may get really close to your screen to read notes on your computer. What else, how else does that impact you in just your daily life? What does that look like? Or what assistive technology do you use?
Yeah, so I don't know if our listeners are familiar with the difference between central and peripheral vision. Maybe it's helpful to kind of do like a layperson's dive into that piece.
Yeah.
Your central vision, as it describes, is processed in the center of the macula, which is the back of the eye. And there's lots of different conditions that affect that piece of the eye and create a central vision loss. And so with central vision loss, you're going to have very low detail vision. So things like reading, seeing signs and faces, driving, and even like walking around safely, depending on the extent of your central vision loss, all of those things are impacted. And then in contrast, peripheral vision impairment, right, is the periphery or the outside of your vision, which is really what you use to discern movement. So when things are kind of moving into your visual field, and also for orientation and mobility, right? When you're walking around, you're using a lot of your peripheral vision to make sure you don't bump into people, to make sure you don't get hit by traffic. You know, all of those are very important daily life preserving skills. And so central vision loss for me, lucky for me, my central vision is the only part that's affected. And so I have very intact peripheral vision. And so when I'm using technology, I use mostly things that help me see details and close things, right? So right now I'm using the built-in magnifier for my computer, and that helps everything be large enough so I can see and navigate my computer. I also use my Kindle. Kindle was a life-saving invention for me as a reader. I have stories of how it was to go through college with no digital textbooks. I'm not that old, but I'm just old enough that digital textbooks were not a thing, right? So the Kindle has really saved my life because it has what's called OCR, right? So it will take the text of the book and it will not only make it very plain and remove all the clutter and weird colors, which is great as a vision impaired person, but it also columnizes it so that when I read, I can make the letters as big as I need, and I don't have to do a lot of scanning and forth, which it can be really challenging for me. So I use a lot of that. And then, you know, part of the challenge with being legally blind or having low vision versus total blindness is a lot of people may not know that you have this impairment. You may have an invisible disability of sorts where, you know, it looks as though you can see, and I can see, and I can see to walk around, but I use a cane in new situations because I can't see people who are in my blind spot. So if a Segway is coming down, you know, Pike Street at me like 40 miles an hour on the sidewalk, it's going to take me a minute to realize that that person is there. And they don't know that I can't see them because they
Right.
don't know that I'm blind because I
Mhm.
don't have the cane, right? So I started using the cane as a signal, really to help
Mhm.
people understand, you know, hey, I've got a challenge here and I really need you to help me out and keep an eye on things, you know, for me. And then it also helps in other situations where my ambulation and my orientation are a little bit off, you know, things in the dark, right? Or in really busy situations, new situations where I haven't navigated and there may be cracks in the sidewalk or steps I don't realize, right? So it's a little bit of my snapshot of assistive technology.
Yeah, it's really great to talk to you because you bring this personal experience with low vision and you are working with students who have low vision, CVI. Um, so I really want to hear about some of those AAC considerations, but I also just want to tap another little bit into your experience because I think it's so important and it's great for parents to hear kind of things that you might think of. It's great for us as professionals and educators. And one of the questions we wanted to ask is thinking about parents. When children are diagnosed with low vision or as they're figuring that out, because I think that can be a process, right? What are some first steps for families? And then I also wanted to know, kind of connected to you, what age were you diagnosed with low vision, and what were some of the resources that you found? And was that easy to find, or how did you find support?
Yeah. So I think the first thing I would remind parents of, because I think as a parent myself and also as a professional working with parents with children who have many different things going on in their lives, right? Like vision is usually just a part of the puzzle for the children that I serve, whereas for me, vision was the only piece that I needed to look at. Otherwise,
Sure.
developmentally, I was on track, and I'll talk a little
Sure.
bit more about that in a minute. But I want to remind parents that you're looking to professionals to really help guide you, but low vision in children, especially children who don't have straightforward presentations, can be challenging for professionals to pick up on. And
Mhm.
so I would encourage you to continue to ask questions when you receive a diagnosis of any sort of vision impairment, because when we assess vision, it's so reliant on behavior, right? What a child is able to show us or not show us. And I've encountered many families, unfortunately, that have gotten an initial vision diagnosis that is maybe quite tentative or not very thorough or not fully explanatory of some of the challenges that we're seeing clinically or educationally for a student. And then they've never got follow-up from the provider. And there's
Mhm.
various reasons for that, right? On both the family
Mhm.
side and the provider side. So I guess I would encourage you to remain inquisitive. Skeptical is not a good word for it, but inquisitive and realizing that even for diagnoses like mine, which are quite definitive and they do not really get better, some vision pieces do, right? And maybe
Right.
we'll talk about CVI today, right? And how CVI is actually a dynamic diagnosis that you can't just do a one and done assessment and then never revisit the issue. And I just want parents to know that. So first and foremost, just asking questions, remaining inquisitive, go with your gut. You're such an in tune, parent to be able to know what doesn't feel right or look right for your child. And don't be afraid to ask questions. And then the first steps, I think, once you've gotten a diagnosis, then is I really recommend getting in touch with any local division services of the blind, right? So they're called lots of different things. In Washington, there's Division of Services for the Blind. It's called DSB. I think there's also several Lighthouse for the Blind locations in Washington State. So
Mhm.
these are usually government funded or nonprofit organizations that are specifically for individuals with blindness and low vision. And they can be just a really great hub for navigating the information you just received, for getting access to services, including financial support for services that may be available to you. Even if your child has a laundry list of other diagnoses, sometimes the vision diagnosis really opens up doors for different services and and different materials and resources that may be helpful to your child as they grow. So I would definitely connect with them in your local community. And again, it'll be like a division of blind services, division of services for the blind, maybe a lighthouse for the blind, something like that. Most of these agencies also have talking book libraries or blind and low vision material banks where you can get really great books, even for little ones. I know Washington has, I can't pin my brain on the name of it right now, but there's a wonderful program where you can get tactile books for children who are low vision. Even children who have some vision may benefit from that ability to have some tactile books. So looking for those talking book libraries or other similar resources can really connect you with great books and also play materials that could help your child access their world while they're navigating their vision impairment. And so, we hope that kids are diagnosed really early. That's my hope, is that we know very quickly whether something's going on. For me, my condition is progressive. And so I was born with a genetic mutation that kind of turned on and started deteriorating my eye over the course of the first part of my childhood. So we started to show that I had vision impairment around the age of 12. But because it was very little known at that time, this disorder that I have, I was misdiagnosed several times before I was actually given the right diagnosis. And so I was properly diagnosed at the age of 15. And so I spent the first half of my childhood typically sighted, and the rest of my life, I won't reveal my age, but it's been enough of time to be, partially sighted or with low vision. And so I don't really know what it was like to grow up with no vision. And so that's something I can't bring to my families that I support. I don't really know exactly what their child is going through, learning to see or learning to learn without sight or with partial sight. But I try to share at least my experience of what is involved on a day-to-day, trying to navigate a world that is really not built for people who don't see well, a learning world, and also just a daily living community that is doing better, but it's just not built for people with partial sight or blindness.
Mm-hmm. And you bring up a good point that even in your situation where it was a process to figure out what was happening with your vision, that is very common for the students that we may work with, or for folks listening for their own children. It's a process, and to keep asking questions.
As evaluators too, I feel like anytime you're seeing a vision impairment that has the word dystrophy, right? You're thinking progressiveness, right? So you're saying, I want you to be able to access it given the vision that you have today, but be mindful that this is progressive and research how quickly is that progression, right? And was it progressive and now it's stable? There's a lot around that speech pathologists don't have a lot of training on. So I think understanding some of that vocabulary is important as you look at AAC evaluations, decisions around access, and where you're headed with all of that.
So we'd love to hear about some of those considerations you mentioned for us as therapists or educators, or anyone working with students with complex needs and low vision. What are some of those considerations that we should think about?
Yeah, well, I want to piggyback first on what Brenda just shared, which is the assessment piece. In our wheelhouse as speech pathologists or educators working in assistive technology and education, and AAC even more specifically, we're always trying to put pieces of the puzzle together, even from the very beginning of reading a chart, right? So we encourage you that if you have a child that's in front of you that you know is at risk, and we can talk about like who's at risk, because that's important. You may not know that, and you may need to gain more knowledge on that. But if you have a child in front of you who is at risk, I'm reading that chart with the lens of vision, especially if this child is going to be an AAC user, but it matters for all kids, right? We need to know how they're seeing in order for them to access their world. But then when we say, well, we're gonna teach this child to be a visual communicator and use images to communicate or text to communicate over time, it becomes even more important. Like if we could even
Sure.
make it more, it's more, right? So when I look through a chart, I'm looking first and foremost of who is at risk. And we were talking about the statistics earlier in the chat, right? So anybody who's coming to you with a developmental difference of their brain is at risk for vision impairment. So that could be a traumatic brain injury, it could be a stroke in utero, any cerebral palsy, any genetic differences, any metabolic changes. If their body has been affected in a way that their movement is affected and their speech is not coming in as expected, I would say that the child is at risk. And you should always have that lens on when you're looking through their chart. I would say, in addition to that, kids with vision impairment that's under identified, and I'm thinking a lot of kids here who have cortical vision impairment, because they're usually the ones that are well under identified. When a child has an acuity deficit, especially if it's due to a structural problem in their eye or a movement problem in their eye, they're usually a little better identified.
Their eyes aren't working together, or they're shaking.
Yes.
Yeah.
Exactly, right? Or even the kid who's, a premature child who maybe had retinopathy of prematurity,
Sure.
you might see that come up in their chart. It's like, all right, I'm going to look for these keywords of things that I know are related to vision. But then we've got these kids who don't have anything related to vision necessarily in their chart. So we have to be detectives, and we have to really start thinking about, okay, is this a child who has been on an AAC device for 3 years and isn't making any progress? Is this a child who is hitting multiple times on the device? Auditory fishing is something that a lot of our kids with visual impairment do, but it looks like what other people call quote unquote stimming or
Sure.
unintentional use of their AAC device. So if I see someone's not making great progress, there's lots of reasons for that, obviously, and we won't talk about most of them in this podcast, but one of those reasons could be vision. It could be vision. And so if I have someone not making progress, especially an at-risk child who has some of those diagnoses we're talking about, then I'm thinking, all right, well, what do we really know about vision? And then along that line, I also want to suggest that you think about no mention of vision impairment doesn't mean there's no vision impairment. So a lot of the times families are told, no, their vision is fine, right? The ophthalmologist is using the tools available to him or her, which honestly for little ones is not great tools. They're all behavioral related, and little ones with complex needs, they don't respond well to these. Even our older kids with complex needs, they can't really show. And so when I don't see anything, but I have an at-risk kid, I'm like, this is a time for me to start a conversation about what do we really know about the vision and what do we not know? What was inconclusive, right? And here's where you'll get into interview with families and maybe even your teams where it's like, well, you know what? He actually hasn't been to an eye doctor since his newborn hearing screening or his newborn screening, where, we had like some tests done at Children's and I think they kind of mentioned something, but I don't really know what it was. This is probably something familiar. So, if you haven't had a recent thorough look at vision for an at-risk child, then I would suggest starting that conversation and not taking no mention as no challenge, right? And along that line too, yeah, you can look for behaviors, and we don't have a lot of time in today's talk to talk about all the ways that vision impairment might rear its head in an observation if you wanted to screen for vision in your assessment, but that you're looking for certain behaviors. For example, many kids with CVI who are at the earliest phases may be light gazers. So they might stare at the lights, they might stare out the window. They might not have purposeful gaze. So if you've got kids that don't seem to be paying attention, right, to you or to what you're modeling on an AAC device, maybe there's some cortical vision involvement going on here that's really getting in the way of them being able to orient to what they need to look at, and also to make sense of what they are looking at in a way that motivates them to keep looking at it. So lots of behavioral considerations, and there's some cool screener tools out there. The EI department in Washington was using one for a while that we'll have to connect about what it's called and how to get your hands on it. But it was a really great behavioral screener to just give us as non-vision people things we can look for, right? Things we might not think of as a traditional sign of a vision impairment, like light gazing, or non-purposeful gaze. Or the absence of visual reflexes, right? When mom or dad can put their hand right in front of that child's face and they don't respond to it. That may not be something we think of. We're usually looking for kids looking close, right? Or we're really relying on a chart to tell us they have a vision impairment. And when they don't, we don't really have a lot of tools. So screeners may be another good consideration.
Another thing that I notice is if a kid closes their eyes or put their head down when they're listening, because I feel like they're telling me that their vision is increasing a cognitive load there. And if I want to listen, I might have to shut off my vision to do that. Have you seen that?
Absolutely. And when you were talking about, when you were speaking to the progressive nature of my condition, which also happens with others, vision changes for some of our kids from moment to moment or sensory input to sensory input, right? And so,
Yeah.
yes, children who have challenges with vision processing may often quiet when they're quiet their vision when they're listening. Right. They also are these kids. I've seen this a lot with children who use voice activated switches like Big Macs that are really common right in the school setting. And they're the kid that's doing this, right? For those who can't see me, I'm turning my head to the side and hitting the button. So they're the kids that look away. They don't look at what they're touching.
Right.
For many of maybe the same processing challenges that you're describing, Brenda, where it's like, I can't really regulate two sensory channels at once. Or when I'm looking, I need to bring my whole physical body in because I have physical challenges.
Right.
And then when I activate, I go into extension and I can't look anymore.
Right.
So it looks like I'm not looking, but really I looked before. And now I'm doing the touching part of the job.
We often decide that that vision is a interest and attention, right? Like, oh, they're not looking, so they don't like it. Oh, so they're not interested, so they don't understand it. And actually, that's just the posture that they need to even listen. But sometimes I have done this where I have someone with low vision to the point where we're not going to be relying on their vision at all for their AAC. So they are doing two-step scanning auditory preview, which for listeners means they're hitting a switch to hear a selection, a list of things, right? Bubbles, music, outside, kisses from mom or whatever. And then they hit a different switch to make a selection. And I have put that in front of a child and they can't even hit a switch when the screen is in front of them because they're trying to visually attend to a screen. And if I have mounted it behind them, so the auditory is actually a little bit higher, and the communication partner can see what's on their screen, but they can then they have no demands of their vision and they do beautifully. Now it seems bonkers. I've had SLPs for sure question me like, why would you mount that behind them? And it's like, because right now I think those are competing sensory systems. And sure enough, as they get more used to the auditory sequence of things, they can then handle the vision in front of them. And again, that develops and that's helpful. But for sure, you can see sometimes that if you really, really, really want me to listen, then I got to turn my eyes off for a minute.
Mm-hmm. Yeah, and I think you bring up a really good point that I think is an important consideration too. And obviously, none of us in the room are vision experts. Sometimes we're called to be because there aren't any experts to rely on in a particular team, which is super challenging. But my first suggestion is always collaborate with the people available to you and find the potential people that are not yet available that need to be available, right? So someone who can help you recognize how this child is currently seeing. This might be a teacher of the visually impaired in your district. It might be a really savvy OT in your community who happens to also have some vision training or vision therapy expertise. It can be a wide range of professionals, but you really need someone to help you crack this code. And part of that code is what Brenda's describing, right? We all have sensory preferences. And even with my vision as deteriorated as it is, I'm a visual learner. I can't sit back and just listen. It's not my preferred channel, but it's become more refined over my age and with more, coordination of my cognitive and motor functions that I can listen more when I need to, but I prefer to look and listen together. Some of our kids, especially kids with really low vision, I've seen a lot of professionals just put tactiles in front of them. They're going to be a tactile symbol user. And it's like, well, it's not necessarily the case. Some of our kids with low vision are tactile defensive. So
Right.
they need some time, right, to prefer that sensory channel, or it may not be their preferred channel, right? Or I've had some who have gone in a similar direction to you, Brenda. It's like, well, we won't even bother with the symbols. We're just going to make the child rely on the motor plan. And that way they can access their device by remembering the motor plan. And we know motor plan is super important, but kids with residual vision oftentimes want to use their vision.
Right.
And so we also have to consider how to modify the visual channel if that's a preferred sensory profile for, or sensory mode for them. So yeah, this idea of getting to know your student and what is their sensory modality, what do they have to turn off when they need to turn one on, right?
Mhm.
And I was just talking with a family right before this chat about these pots that kids have to balance, right? You have to balance my sensory motor pot and my vision pot and my hearing pot, and then you're getting really excited, and so I'm getting dysregulated because I'm really excited. And so
Mhm.
then what's available to me, and what do I have to have help to peel away in order for me to bring my best ability to the task?
You know,
Mhm.
I love everything you just said, Tanna, that and a lot of this comes back to what you mentioned about kind of being a detective and knowing that there may be more to the story than what you're seeing either in the paper or with the student's vision just as you're looking at that student. I wonder if part of the challenge, you said that there's not always access readily available to someone who has the expertise in vision, or we have a certain time to do an evaluation, or people are missing, or it's this time of day that we happen to see them and they're tired or they've had all these experiences. And so part of it is time, part of it is resources, right? But you make me think about families a lot and how important it is to lean on them for information. When you're talking about the behaviors that you might notice, well, who is going to notice that better than family who is with them so often? So I appreciate you bringing that whole piece out, and just that we need to keep looking and looking.
Yeah, and I would add to that just quickly, Sarah, that the questions we ask of families, I mean, we're trained this as providers in general, whether you're an educator or you're a therapy provider. Interviewing is a skill you refine over the course of your career. And we know with kids with complex communication needs, interview is kind of like our best assessment tool, right?
Sure.
So I would definitely consider, if you've got students that are on your caseload that are suspected to have vision challenges, and you're just kind of like, oh, I think there might be something going on, really figure out what questions I need to ask of my families to really get to what I want to know. Asking, is there any vision impairment, usually is going to fall quite flat. If it isn't in the chart, the family probably doesn't know. I had a clinical instructor, a colleague of mine, that always say this about developmental milestones too, right? Like when you're asking the mother of a 10-year-old what age her child walked, and she didn't fill it out in the intake, it's probably because she doesn't remember, right? And
Right.
so if they knew it would be in there. And so the types of questions we ask really need to be tailored to knowing a little bit about what low vision behaviors and cortical vision behaviors look like. So even if you're not trained to give an assessment, I would highly recommend doing some professional development on sites like Perkins School for the Blind, or even looking at some screening tools available to try to fill your interview toolbox.
Mm-hmm. Great. Um, Tanna, are there some myths that you can think about for people with low vision that you think we haven't addressed yet that would be important to talk about?
Yeah, one of them I just spoke to a little bit, which is that every child who is blind, right, needs to use tactiles to communicate. And that isn't true. That there isn't a one size fits all for a low vision child or a child with CVI. And so that is why we need to rely on our professionals to really help us understand the vision needs of each of our communicators. I also think we spoke a little bit at the beginning of this idea of, if you are a certain label like low vision or blind, that you can't do X, Y, or Z. And so sometimes when I was younger, it used to drive me insane. I worked at a costume store. That was my first job, and I was a cashier, and I was legally blind as a cashier. And so you can imagine, the people that would come up and see me looking at their credit card like this.
Nice. You had it pulled up really close to your face, like pulling the, yeah.
Yes, absolutely. And the first thing they would say is, you need glasses. And so that's a big misconception that I really work a lot personally with people that I meet, but also help parents understand. People have a certain understanding of what it means to not be able to see well. And for them, it's you need glasses. So everything in your life is going to be solved by glasses. And for a lot of our kids, lenses are not going to make a difference for them. And so being able to really understand the nuances of vision impairment, and we talked a little bit about the central and the peripheral, but there's also problems with the eye versus problems with the brain, and that there may be you may have to do some explaining to professionals on your team about why your child's particular vision impairment does not manifest the way they expect it to.
Well, I think that's a great point to not just assume that people know what this means when you say, even if you say the student has CVI, we kind of sometimes don't want to say, okay, now what exactly does that mean? Or because it also may look really different for one student than another, right? So to explain a little bit more, this is what you might see.
And I want to speak to both of them as you just talked about. One is that the tactile, and if the child has cerebral palsy, they may not have functional use of their hands for that tactile, as well as Braille. So we can decide that, oh, everybody that has low vision needs tactile. And then what we've decided sometimes is that means we're going to do hand over hand because they can't independently do that. And so we've really put them, and sometimes that's very tactily defensive. I don't want you to control my body, and my tone is it's such that you can't really help me do that. So I think it's important that, it's not a one size fits all. It's not like, here's the low vision, so here's the tactile buttons. Here's the low vision, so here's high contrast. Here's the low vision, so here's this. It's like there's not a if then kind of situation. It's very, very case by case. And I think the motor piece is something that we have to consider when we're looking at tactile and Braille and all that kind of stuff. The other thing is about the glasses piece. A lot of times I'm doing evaluations, especially for really young children, where the parents are saying, well, he has glasses, but he doesn't tolerate wearing them. So first thing for me is the prescription even correct then? Because usually a lot of kids will wear them when it's helping them. Other kids are really tactily defensive to wearing glasses. And then it's like, okay, well, are they nearsighted or are they farsighted? Like, that will help me, right? And the parents are like, I don't know. Right. So sometimes it's like, I feel like that would be worth learning about. Like, if they're nearsighted, what is that? If they're farsighted, what is that? When I look at eye gaze, those devices have to be 18 to 22 inches from your eyes. So it's like, are they nearsighted to the point where something needs to be 3 inches from their face? Because then eye gaze actually is not a choice for you, right? Or are they farsighted to the point where it's got to be really far out there for them to have clarity? Then maybe eye gaze isn't a choice for you either. Like, all of that kind of stuff. Sometimes I feel like, I'll be at the eval and I'll be like, I don't know. And it's like, well, that's worth knowing. But also in my evaluation, let's see what we can figure out so far about what we think that they can see. And then they'll be like, well, I know they know that they track the dog walking across the room. That's helpful information, right? And then they're like, oh, I know I have to get right up on her face for her to smile at me. So I'm pretty sure she's pretty nearsighted. And by the way, even those words, right? It's like, well, what does seeing far mean? What does seeing near mean? Does it mean they're nearsighted or they're far? Like, even the wording, people aren't sure of,
Yeah, and you also bring up, sometimes depending on the root cause of the challenge with the vision, the behavior could be telling us something different, right? So for a child with an acuity challenge or nearsightedness, looking close helps them focus. That's a
Sure.
lens problem. But for a child with no acuity challenge that still looks close, they may have a cortical visual impairment, and looking close reduces complexity. So it isn't about making the image clearer to see so much as it is when I put things close, all the clutter that I can't make sense of goes away. And what I'm looking at is within this small frame that I've created through my positioning, right? So I love that you mentioned how important it is to know a little bit more about what's provided. And one of the things I was preparing to talk about today is what should non-SLPs or vision people know about how to support AAC, assessment and intervention processes. And one of the things is we need more thorough reports. We need families to walk away with a report that not only has a bunch of jargon in it, but really explains what this means for the child's functional life.
Right.
Right. And part of that is, you said a refractive error of blah, 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 blah. And the parent brings the report in and that's all that's there. But we don't know what that means for participation in life. What does that mean for educational planning? So I really believe our vision teams could do a better job of letting that parent walk away with a thorough picture of vision that is in their layperson language.
And that starts with the ophthalmologist, honestly.
Tanna, can you think of any examples of reports that have done that? Can you think of maybe some wording that you think, oh, this is so helpful?
Yes. So, I work most of the time with children with cortical visual impairment. Some of them have ocular challenges too, but most of them we're focusing on the cortical aspect. And when you have a really solid CVI report in front of you, what you have is someone who's conducted a full range of the CVI range and has given you a detailed explanation of the way a student's particular visual behavior looks, or interview responses from the family about their behavior looks under each of these vision categories. So for example, the report might have the category of latency, which is on the CVI range, and it'll have that category. It will explain in layperson's terms, what are we thinking about when we're thinking about latency? And one of those explanations might be, well, latency is how long it takes that child to show that they're seeing what I'm presenting in front of them. And how did I know that they were processing and needed to show me that? How did I know that? Let me describe that underneath in the report to show what the latency looked like. So I think just in general, very clear categories that line up with the assessment domains that make sense to us as AAC providers, things that we need to know in order to make plans for tools and strategies. I want to see a report that has that. I want to see it defined underneath, and I want to see what did it look like in this particular child, right? And then I think what we can do then is also use that as a criterion reference as we move through trial of different strategies in our AAC supports, right? For example, a child who needs low complexity. Well, you and I, all of us know in the room, we don't want to go to a 4-cell array if we can help it, right? We really want to give kids a lot of words. And so when I see reduced complexity, I want to know more about that so I can make a plan to shoot a little higher. And then start to systematically peel complexity away and see if I have a change in response, right? So, Sarah, I don't know if that answered your question, but the perfect unicorn report has all of those things, right? And also a statement that says, and I would love to talk with you about how I can support you in your quest to, educate your child and teach them to communicate, right? So that willingness for our vision team members to take the lead on this, right? Because vision, if I've got a kid in front of me as an ophthalmologist who has a history that shows me they're going to be non-speaking perhaps, or they're not speaking at an age that they should be speaking, I want them to be thinking about AAC too. And how does my job as a vision expert play into helping the rest of this child's team and their family plan for that?
Absolutely.
Yeah, love that. Tanna, you've given us so many resources to look for, whether you're in Washington State or somewhere in the United States or around the world, thinking about things like profiles, questions that you can ask families when you're interviewing, what you might be looking for in a vision assessment. Are there other resources that you'd like to share?
Yeah, I think, my go-to resource for any professional development related to vision, including cortical vision, is always Perkins School for the Blind. It's a little pricey, to be honest, but if you have kids that have these needs on your caseload, I highly recommend investing in it. If you go to their website, they've got tons of webinars that you can attend specifically on vision considerations when it comes to communication and communication learning. So definitely visit them. Also on my website, the nonprofit that Sarah mentioned at the beginning, it's called Accessible with AAC in the front of the word, AAC, accessible. So I've created a section called the stacks, kind of like a library. The stacks, you know, if you've ever spent time in the like physical library in the past. And that's where I've curated a little section in there called AAC Envision with just other great websites and tools that I've encountered over time. Accessing that on Accessible is completely free. It's not a charge, but you might find some resources from other people on there that might be for charge. But there's things like, you know, how to learn more about tangible or tactile symbols, who's a good candidate for them and how do I teach them. There's also links to other websites that have great trainings related to vision for kids with complex communication needs. So I would definitely recommend that. And I think those two would be a good starting point. And I'm sure there's like a rabbit hole that they will take you down of additional resources once you start in. You guys know how that goes.
So
For
true.
sure.
And I do want to point out your website, Accessible, because there is so much on there. I mean, definitely related to vision. Those are some really good resources you told us about. But also, I love the find a provider part, and it feels like you're really trying to gather community through your website. You know, collaboration is so important. Can you tell us a little bit more about that piece of it?
Yeah, you know, I started Accessible during COVID. I had a little bit more time on my hands because I wasn't commuting to and from the university. And it was something that was really on my heart for a long time. I feel like I went through this, and many of the professionals that I encounter and I mentor go through this feeling that they just were ill prepared for how to support kids with different needs. They have really no interest in being an AAC quote expert, but there's a clear necessity that they need to know something about it. And
Sure.
I was finding that it was really difficult unless you worked in a place that had somebody who knew what they were doing. It was really hard to connect with people who had an interest in this and who wanted to give of their time to help you get better at it, or at least feel less sick to your stomach about it, right?
Yeah.
And so that was a big catalyst for it. And I also found that the AAC training is very spotty, right? If you go to ASHA, you might grab a short course or two, and they can be a little redundant sometimes, and you might have a hard time walking away from this 1 hour course and that 1 hour course with a big picture strategy to
Sure.
employ. And so, yeah, another catalyst for the website was really taking it and looking at it more like a graduate course that you might have taken, you wish you might have, taken when you were in school, but it was never offered to you. And how do we really break this process down for people? And then make it available to families, right? Like, why should I be the gatekeeper of the AAC assessment course at the $500 conference out of state, right? Why can't we
Right.
just put this out there and say, hey, families, you don't need to just go buy the app that's on the App Store commercial most often. You can actually go and listen in for free because we offer caregiver access for free to all of our trainings. And you could like learn the lingo, right? And start to be able to have a conversation with a provider that may be less educated in this area and really own it and take charge of it like you want to do because you have the information that you need. So we try our best to put resources there for everybody. Nobody is not, nobody doesn't belong at that website. Everybody belongs. And also we try to make it either free or super low cost. And if you can't afford something, you just reach out and we make it happen for you.
That's wonderful. I think we
That's awesome.
applaud the people who are just putting information out there
Yeah.
because we need it, right?
Mhm.
Nobody needs to own everything, right?
Being the gatekeeper of knowledge that everyone needs is frustrating. So I really appreciate the resource as well.
hmm
Yeah, absolutely. It's a joy and a passion of mine. So I'm super happy that I get to do it.
We can tell. Tanna, thank you for sharing all the resources, and thank you specifically for sharing your own story with low vision.
Yeah.
And I learned a lot from you, and I hope I'm sure our audience did as well. So thank you for joining us.
For your candid conversation about all of it. And we appreciate it because we can dance around whose role is this and where, who should be doing what and all that kind of stuff. But the reality is that we're all here for the same reasons, to help the child, and we all need a little more resources and to be more informed about vision than any SLP has graduating from school. So
Absolutely. And that's a brick in your backpack, but hopefully a blessing at the same time, because a transdisciplinary model is really what's demanded of us as
exactly.
SLPs, especially supporting the kids and the adults that have more complex profiles. And so unfortunately, there isn't an expert to pass these kids on to most of the time. And so
Right.
we have to do our very best, right, to think of things a little bit more holistically than maybe we were trained in the beginning.
Definitely.
Sure.
Yes. Thank you so much.
The contents of this podcast were developed under contract with the Washington Office of the Superintendent of Public Instruction, U.S. Department of Education, and administered by Central Washington University. However, those contents did not necessarily represent the policy of the OSPI and CWU, and you should not assume endorsement by the federal and state government.